Nursing student Jason. Today I'm going to be giving you some morphine. I'm told that you're experiencing some pain. Can you give me a from 0 to 10, 0 being no pain, 10 being the most pain you've ever felt? Can you tell me how much pain you're in? You're at wow, 12. That's a lot of pain. All right, that's probably why the doctor, according to his order, wants me to give you some morphine. At least. If you are who you think and who the doctor thinks you are, can I get your name and date of birth? All right, that's correct. Good job. All right, I also, before we get started, I have to get a baseline, for where you're at. So can I get your vitals real quick? All right, cool. Got your blood pressure, all that. You got a high blood pressure. You must be in a lot of pain. Pain can actually make your blood pressure high. So anyway, but now that I know that who you are now, so I know I've got the right person. I know what the medication is according to the MAR, which I'm going to be verifying quite a few times, and then I know the dosage, or according to the order. Let's see, I've got the indication. They are in a lot of pain. Let's see, there's patient, medication, indication, the and how much. According to the doctor's order, I'm going to give you 2 milliliters of our good old painkiller here. So I'm gonna go get, and then I'll be documenting as well. So anyway, I'm gonna go do hand hygiene, get the medication, and I'll be back with all my supplies. All right. Wash my hands, sanitize. I'm gonna go ahead and put on some gloves just because. So I'm going to look at the order again. I looked at it one time, which told me the reason why I was going in there. But I'm going to look at the order again for the first time and get out my morphine. And this is morphine. Okay, cool. And then, so I know that morphine is a drug that I want to know about, and I'm going to have to teach about. So I'm going to look it up and find out, how quickly I need to give it. And so it turns out I have to give it, over the course of 4 to 5 minutes. And then I'll also be giving I'll be flushing it for an equal amount of time as well. So, but I also want to teach them things like why I'm hanging around. So I gotta know things like the really important stuff like coma or increased intracranial pressure or seizures, or just monitoring them for things like that. So when I go back in, I would tell them things like, I could even bring the book with me and just tell them, these are the things I'm going to be looking for. This is the reason why I'm hanging out with you, and I'll be able to chart right in the room while during that time, just so I'm not wasting time. All right, so I got this out so I verified that, and so now I'm going to clean this up. So I would pop the top off and clean this. Make sure that is sterile. All right, and I'll give that time to dry, probably like 10 seconds or so. But so that 10 seconds will go by while I am getting my needle. So I've got my needle, I've got a syringe that I am going to hook up. All right, I'm going to take this off, and I'll put that right on the edge there. And I'm going to get 2 milliliters out. So I need to put 2 milliliters in. All right, there's that. So I am going to, stick that. And try not to draw any air. Oh, wait a sec. I want to put the air in first. And now, I don't want to draw any air. Hopefully I won't. think I want to get just a smidge more. Well, nurse, is that 2?
Yep.
Cool.
Perfect.
Thanks, man.
My pleasure. Safety first.
All right, so now I'm going to place this in my little transportation, whatever, my little container that I can walk through the halls with. And when I get there, I'm also, I want to also, let's see, I would say Minnie Mouse. Let's see what her MAR number is and what the, let's see, morphine, 2 milliliters. Okay. I'll go ahead and label that like so. Okay, so now I'll bring that, and I'll bring some whatchamacallit, some saline with me to flush things with me as well. And so now I can take these off, and I put these in the saline with me. Nurse, can you help me dispose of this?
Certainly.
All right, thank you. All right, now we're gonna transport this over here. I'm back. I know. I'm sorry it took so long. There's, I'm gonna hand sanitize. I know you're in a lot of pain. We're gonna see if we can fix that. I'm gonna grab some gloves. I'll recycle these gloves. I'm gonna pretend these are new, clean gloves. All right. So it looks like your IV site it looks good. It doesn't seem to have any problems. So I can, is it causing you any pain in this area? All right, just wanted to make sure. I'm also going to, I'm going to take, let's see, I want to take this, oh wait, before I take that off, I want to clean this right here. I'll make sure that is nice and sterile. All right, throw that away, give that time to dry. And I'm going to take the lid off there, pull back on it, push back to get any kind of whatchamacallit, and get the air out of it. I would connect this to here so that I can make sure that this line is still good. So I want to go ahead and flush it, and so if I'm flushing it, I also want to make sure that there's no infiltration. I want to make sure that this isn't cool. I want to make sure I'm not causing the patient any pain. I want to make sure that there's no swelling. There's all those things. So put like 2 to 3 milliliters of saline in there by flush, and then I can go ahead and I can discard that one. So now what I want to do is I'm going to clean that again, just because I handled it. And I'm a safety guy. I want to make sure that's all nice and clean. And so now I'm going to connect this, and I have to give this over the course of 4 to 5 minutes. So what I'm going to do is I would use my cell phone, which is in my observer's hand. But now I'm just going to set a, I'm going to go ahead and, all right, cool. And I'm beginning my push. All right, let me know if you feel any differently. All right, your pain may be going away, or if not yet, shortly. So do you have any kids? No? Are you married? No? You know any good jokes? We got some time. A little bit of time. It's just you and me. We can bond a little bit. Do you have any hobbies? Are you from Idaho originally? No? Where are you from? Well, that's cool. All right.
You like buffets?
Do you like buffets?
Yeah, do you like them? I love Golden Corral. Their bread rolls are delicious.
That's true. Man, I haven't been to a Golden Corral in forever. Man. We're doing good things here.
Mm-hmm.
Are you feeling it? Where would you put your pain scale now? All right. So where do you see yourself in 5 years? Cool.
Mm-hmm.
Where do you see yourself in 5 years?
I don't know. Making money. Have an apartment.
Yeah. Will you be married in
I
5
don't know.
years?
Couldn't tell you.
You may have kids in 5 years.
I could. I mean, I could have kids now.
Who knows? Do you have kids now?
No.
You just don't know about them, you're saying? It's possible. Could
Yeah,
happen.
I mean, potentially. I mean, the possibilities are endless in this massive
Who
world.
knows? Oh, man. I'm telling you. We're right on track here. We're about a little more than 3 minutes in. We got a half a mil left. We're rocking this. If you could live anywhere, where would you live?
Montenegro.
Montenegro.
Mm-hmm.
I don't even know where that is.
Me neither. I just think it sounds nice.
It does sound like a nice place.
I think a place that's named that couldn't be bad, you know?
Oh, man.
It has to be lovely to live there, like a resort.
That does sound nice. Where's that? I'm told Rio de Janeiro is a really nice place. Like the people, because Jesus is up on top
Yeah,
of
I've
that
seen the
mountain.
statue, yeah.
Yeah, and so the people there just have that constant reminder: love everybody.
Well, I don't know. I mean, they have a big, like, favelas and stuff. A lot of slums.
Oh well, every place has its bad place, right?
Yeah.
All right, we're over 4 minutes, and we're just finishing up. Boom! How you feeling? You feel a lot better, huh? That's good. That's good. I take that off. All right. So now I'm gonna put this back on here. I can go ahead and set that. I would just put that in the sharps container, and then I'm gonna go ahead and clean this off. Because that's what we do around here, Try to keep things clean. It's a hospital, man. It's a hospital. Nicely done. Throw that one away. All right, now I'm going to try to give you two more milliliters over the course of 5 minutes.
It's okay, just a labeling. It happens, especially when they get soaked.
Yeah. If I don't.
That happened to mine as well, because the glue came off.
All right, so I will start my timer. All right, and here we go.
How long will we be giving this one for?
4 to 5 minutes. Yeah, just gotta be patient. You can't rush a good thing, man. Can't rush a good thing.
Hmm.
Do you like sports? No, me either.
Ping pong. I like a good match of table tennis.
I like ping pong.
Badminton.
Badminton. That sounds cool.
Yeah, it's a peculiar one. I know a lot of people like, what's that one called? It's like slow.
Pong?
No. No, it's like with like
Pickleball.
Yeah, pickleball.
I've never played it.
People like it because they don't have to move around much.
I've never played it, but I know there's a lot of people that like it.
Yeah, not my thing. The ball doesn't bounce very much because it's... Anyways. Yeah, I've heard people say they like it just because they don't have to move around a whole lot.
That's funny.
Mm-mm.
All right. So, are you feeling nauseous or anything? You're still breathing pretty good. Nice, good to hear. It's too much. Too much of this can suppress your respirations. So we gotta monitor you. I'll be hanging out with you for a while, for about 15 minutes, making sure that you're still kicking. You know, not to scare you or anything. But yeah, this medication is no joke. It can also be addictive or addicting. You gotta be careful with it. So if you can go without it, you should probably try, because you can build a tolerance to it. It's good you're not on any other medications at the time. If you were on some type of MAOI, monoamino oxidase inhibitor, then it'd be contraindicated. So we wouldn't be able to give you this. All right. I think we're almost there. We got like 15 seconds left. You're rocking this joint. Good job. Never thought your rubber arm could have taken so much stuff. All right, there it is. That's pretty cool. Good job. You took that like a champ. All right. So now I'm not going to attach anything else to it, but I still want to clean this up afterward. All right, how are you feeling? So the clock starts now. I'm gonna be hanging out with you for 15 minutes. I gotta chart what I just did. And in 15 minutes, you can tell me if you're feeling this pain or not. And I also want to, I'm gonna get your vitals again, just so I can see, I can compare that to the baseline from the vitals I got before. And I'll clean up while I'm doing all this stuff. All right, Shazam. We cleaned up, did my hand hygiene, and now I'm gonna give you your call light and make sure that you're in a comfortable position. We did all your find out where your pain is at, and I'm gonna document everything that I did, probably right there in the room because I had 15 minutes to do it while I was making sure you're still breathing. And yeah, I think pretty sure that's everything. Oh, but I want to make sure I throw all my stuff in everything that's sharp. I would throw in the sharps, and that's it.